A number of healthcare workers are feeling frustrated with the New York State Department of Health.
That's because they say the state is not enforcing a staffing ratio law that would impact more than 200 hospitals. Tonight, our New York Capitol correspondent Elise Klein tells us more about it.
In 2021, New York lawmakers passed a law to establish minimum staff-to-patient ratio standards in hospitals. A little more than a year after the law went into effect, groups of nurses and healthcare workers traveled to Albany to call out the Department of Health, who they say are failing on enforcement.
If you become a patient in a New York hospital, you deserve enough nurses and frontline healthcare workers to take care of you, and that's not happening right now.
Michael Fitzsimmons, an ICU nurse at Albany Med, says staffing ratios that by law are supposed to be 1 nurse to 2 patients for the ICU and 1 to 4 for the nurses on the medical and surgical unit floors often get pushed beyond the requirement. Fitzsimmons says nurses are also not receiving consistent breaks during their shifts, which he says can lead to issues.
And when I do take a lunch break, the nurse next to me has to watch my 2 patients. So basically for a whole period of time, the whole ratio changes to 1 nurse to 4 patients at times. So it's very difficult working conditions in our hospitals.
Nurses who rallied in Albany say they have filed thousands of complaints about their hospitals violating the staffing standards. And while the Department of Health said they have investigated 409 complaints and issued 32 statements of deficiency to hospitals, some nurses say it isn't enough.
We have only witnessed a handful of the DOH investigation. So what do we say to the DOH? Do your job!
In Albany, Elise Klein, WENY News.